Hi, my name is Dr. John Heary, and today we're going to talk about an important health topic that is often overlooked. What is your waist hip ratio? What does it have to do with your health? So we're going to talk about this, and this is some great information that was shared from Eva Functional Medicine University. So the waist hip ratio, it's a quick measurement of fat distribution. It helps to indicate a person's overall health. And so when we look at your waist hip ratio, and some of these stats, they come from the World Health Organization. What they say is that having a waist hip ratio of over 1.0, it may increase the risk of developing conditions that relate to being overweight, including heart disease and also type 2 diabetes. And this might be the case even if other measures of being overweight, such as body mass index, your BMI, even if they're in normal range. So, according to the World Health Organization, the risk of being affected by weight-related health conditions increases if your waist-hip ratio for males, if your waist-hip ratio, it should be lower than 0.95, and female should be lower than 0.8. So your increased of health risks goes up as that number goes up. And the research shows that people who are apple-shaped, they have a greater risk of certain health conditions than those who are pear-shaped. And again, pear-shaped, that's when the hips are wider than the upper body. These health conditions, they include cardiovascular disease. There's a study that found that abdominal obesity increased the risk of cardiovascular disease and cancer. And there's another study in which the waist hip ratio predicted, cardiovascular disease more effective than BMI or waist circumference. And there's a third study that they looked at that showed that waist hip ratio, it's a better indicator of risk of mortality from cardiovascular disease than waist circumference alone. Back in 2016, there was a study done that found if you had a waist circumference that was increased, that was linked to an increased risk of type 2 diabetes. And another study that I saw in 2002 showed that if they had a greater waist hip ratio of 0.8, that they also had less of a chance of becoming pregnant. And there's another study showing that the waist hip ratio was much more important than your actual weight. And that one was done. There were 75,000 people that were 75 and older. So, when we look at waist hip ratio, what we find is that it's more accurate than BMI for predicting the risks of cardiovascular disease and premature death. So what this means is that it's the location of the fat being around the waist, okay, around the belly, that was more important than actually how much you weigh. There's a lot of research and many studies that all support the importance of measuring your waist hip ratio. And again, for men, guys, you guys need to be lower than 0.95, and females should be lower than 0.8. There's also more research that showed that waist hip ratio, it's also an accurate tool for predicting high blood pressure. And there's another study showed that it's a better indicator than BMI for predicting complications in trauma patients. Back in 2018, there's another study that showed that a high waist hip ratio was a significant predictor of death in women from heart failure. And again, I've mentioned other studies, and there's more that show the relationship with high blood pressure and diabetes. So there's many health benefits to having your waist hip ratio within a normal range. And there was a study that showed just by decreasing the waist hip ratio by 5% significantly lowers your risks of developing chronic kidney disease and non-alcoholic fatty liver disease. So, how do you measure it? Super simple. Just need a tape measure and calculator. You want to measure your waist at the smallest point, which it's usually going to be at the navel, and then you're also going to measure your hips at the widest or the largest part, and then you're going to divide your waist measurement by your hip measurement. And really what the idea here is, and what you're looking to get to, is that your waist, it should be smaller than your hips. If your waist is bigger than your hips, that means that you have too much fat concentrated around the middle, around the belly, that part of your body. And that indicates that you have a high level of intra abdominal obesity. So really the concept is very simple here, is that intra-abdominal fat is bad for your health. Okay. So, it's a good, like I said, you want to, definitely take a look, measure your waist hip ratio. It's a quick way to get, an indication of your overall health, of obesity levels, and of your risk of weight related health conditions. All right, guys, until next time, I'll talk to you guys soon. Hopefully you guys got some great information of that. Okay, guys, have a good day. Bye now.